Can you treat gonorrhea with garlic? Can you treat gonorrhea with garlic? Gonorrhea, often known as gonorrhea, is a bacterial infection-based sexually transmitted disease. For this illness, garlic is said to be a natural remedy. So, does the garlic remedy for gonorrhea actually work? Gonorrhea is brought on by a bacterial infection called Neisseria gonorrhoeae. During sexual intercourse, the gonorrhea bacteria are frequently transferred from one person to another. Garlic's antimicrobial components are thought to be one of the ingredients that can treat gonorrhea. In a 2005 study published in Phytotherapy Research, researchers looked into how garlic compounds affected the Neisseria gonorrhoeae bacteria that causes gonorrhea. The scientists discovered that 47% of the garlic compounds shown antibacterial action against these bacteria as a result. Unfortunately, the research is still being done in the lab and not on actual gonorrhea patients. Additionally, researchers did not specify how to utilize garlic's therapeutic effects for gonorrhea. The ability to directly consume garlic or even apply it to your sex organs is still unknown. As a result, more research is needed to evaluate whether garlic is beneficial as a home remedy for gonorrhea. Can gonorrhea be cured with natural treatments? There are no herbal remedies or other natural compounds that have been clinically demonstrated to treat gonorrhea outside garlic. Garlic and other natural therapies have been put to the test by researchers, but they were proven to be ineffective in treating venereal illnesses. To stop the infection from spreading and leading to consequences, you can only currently receive treatment based on a doctor's prescription. According to the Mayo Clinic, those with gonorrhea who do not receive treatment or the appropriate therapy run the risk of developing consequences like the ones listed below. 1. Infertility in men. Men who have gonorrhea may develop epididymitis, an inflammation of the sperm-carrying tube epididymis at the testicles back. Men who have severe, untreated epididymitis may have trouble getting pregnant. Infertility. 2. Infertility in women. Women who experience gonorrhea may get pelvic inflammatory disease. The fallopian tubes that transfer eggs from the ovaries to the uterus may become damaged as a result of this illness. Women are more likely to experience infertility as a result, as well as ectopic pregnancy, which happens when a fertilized egg develops outside the uterus. 3. The infection spreads to other parts of the body. The bacterial illness Neisseria gonorrhoeae, which causes gonorrhea, can also travel via the bloodstream and infect different bodily regions. This illness may result in joint discomfort and swelling, liver inflammation, damage to the heart and brain valves, and even death. 4. Increased risk of HIV/AIDS. Human immunodeficiency virus (HIV), which causes AIDS, is more likely to infect gonorrhea patients. In the meantime, those who have these two illnesses are more likely to spread STDs to their partners. 5. Complications in babies. Babies who contract gonorrhea from their mothers after childbirth are more likely to experience infections, scalp injuries, eye problems, and even blindness. In order to prevent infection, the medication must be administered to the newborn right away after birth. So, What is the right treatment for gonorrhea? There is no evidence that treating gonorrhea with garlic or other natural treatments works. The best method for curing gonorrhea is antibiotic therapy. Antibiotic therapy for gonorrhea seeks to stop the growth of germs and stop the spread of the infection. Doctors recommend a combination of oral azithromycin and injectable ceftriaxone, because to the rise in bacterial resistance to antibiotics, azithromycin. Your doctor may prescribe alternative drugs like gentamicin and cefixime if you are allergic to ceftriaxone, gentamicin. The proper medical care can totally cure gonorrhea. The length of time it takes for gonorrhea to clear up also depends on how bad the infection is. Gonorrhea in its early stages can disappear 2 days after receiving medicines. However, you must continue taking your prescription for the full amount of time that the doctor has prescribed. In addition to that, there are several additional considerations for gonorrhea treatment. 1. Check for sexually transmitted illnesses with your partner to determine the likelihood of contracting gonorrhea. 2. Take all prescribed medications as directed, and avoid giving your spouse any gonorrhea medicine. 3. Delay having sex until both you and your partner have finished the course of treatment and the gonorrhea symptoms have subsided. 4. After you and your partner have finished all of the medication, wait around 7 days before having sex again. 5. Patients with gonorrhea should be checked roughly 3 months after receiving initial therapy due to the common risk of reinfection. Thank you friends for watching this video until it's finished. Hopefully it can be useful in everyday life, and hopefully we will always be given health, both physically and mentally. Don't forget to like, share and subscribe, of course, for the progress of this channel. Thank you.